you?
Good, how are you?
I'm good. I'm Leighton Swoboda. I'm a physician assistant student. I'll be out in the clinic today. Today they brought me in, they said that you might have some memory problems, some mild cognitive inhibition, but before we do any of that, can I get your name and date of birth?
Yes, Morgan Asbell, 11/26/1954.
Perfect. And how would you like to be addressed today?
Morgenstein.
All right, Morgan. So I understand you might be having some problems, remembering things. Can you tell me more about that?
Yeah, I used to have a great memory, and now I feel like things kind of come and go sometimes. Don't always remember what happened.
Okay. Is there any specific scenario that you think about when you think I can't remember something?
Yeah, like my friends or my daughter will tell me like we had the same conversation yesterday or the day before, but it's all new to me.
Okay. And have you been experiencing any other abnormalities, like any changes in vision, hearing, any you find yourself hot, any fever, things like that?
No.
No, just memory, nothing else.
Yeah.
All right. Are you taking any medications?
No.
No. Okay. Well, so what I like to do is perform a mini mental state exam. So what all they'd be doing is asking you a few questions, asking you to answer certain things. Do you consent?
Yeah, if it can help get some answers, that's great.
Perfect. All right. Here. All right. First question. We're going to assess your orientation. So, what is the year, season, date, day, and month?
Okay, so it is Monday. We're in spring, and the date is 5/18/2023, and it's May.
Perfect. All right. Where are we? What state, country, town, and hospital and floor are we on?
Okay, we're in Richardson, Texas.
Okay.
That's in America. And we're at Baylor Scott and White on the 3rd floor.
Now we're going to assess your registration. So all I'm doing here is I'm going to name 3 objects out and you recall them to me whenever I'm done, okay? So pickle, nachos, city.
Okay, pickles, nachos, city.
Perfect. Now we're going to assess your attention and calculation. So what I'll make you do is count down from 100 by 7. Does that sound okay?
Yes.
Okay, perfect. Whenever you're ready.
100, 93, 86, 80, 70.
All right, now recall the 3 objects from earlier.
Pickle, trash can, boots.
All right. Now we're going to assess a language. So see those 2 objects on the corner of that counter right there?
Mm-hmm.
What are they?
A watch and a pencil.
Perfect. Which one's the watch and which one's the pencil?
The watch and the
This one?
pencil.
Pencil?
Yes. Mm-hmm.
Perfect. All right. Now repeat after me. No ifs, ands, or buts.
No buts, ands, or maybes.
All right. Now, see that paper right there?
Mm-hmm.
What I'm going to do is take the paper in your hand, fold it in half, and set it on the floor. All right. Now I want you to read this sentence right here and obey the command. Perfect. Now what I want you to do is write a sentence right here. Any sentence you want is just 3 to 5 words.
Okay.
I need coffee too. All right. And last one, if you could just copy this design right here for me,
Okay.
right next to it.
Okay. Just draw the same thing.
Yes, ma'am.
Okay. not much of an artist.
It's okay, me neither. Alright. Alright, I'm gonna tally these scores up real quick, just hang on for 1 second. Alright, Morgan. So you scored a 22 out of 30. So, any number less than 24 is indicative of some mild cognitive impairment, so maybe there might be something going on. Would you mind if maybe today, before you left, if we could get some blood work done, like a CBC, CMP, as well as or like some thyroid labs, things like that? Would that be okay?
Yeah, for sure.
Are you okay with needle? I don't want to pressure you into. If you don't want to, that's okay.
No, that sounds good. Whatever you think is best.
All right, let me get this done before you leave. All right. Let's see. And what would you like to explore medicinal or medications for treating this possibly? Or if you don't want to see treatment, that's fine. Or would you like to learn about some non-medicinal treatments as well?
Yeah, whatever you recommend. It's all a little scary for sure.
Mm-hmm.
So if you can recommend something, that would be great.
All right, I'll tell you what the options are. So what a common medication that we use is Donepezil. It's a acetylcholinesterase inhibitor. So basically, it stops the molecule that degrades acetylcholine.
Mm-hmm.
So acetylcholine is the chemical molecule in your brain that kind of connects the dots. So how I say it allows your brain to connect different areas and put memory and stuff together.
Mm-hmm.
That's a common one. There's also galantamine, which is also acetylcholinesterase inhibitor. Those are two common medications. There's also non-medicinal like therapeutics, such as just cognitive exercises. Like I'm sure maybe your age might enjoy like Sudoku, crossword puzzles, word searches, board games, things like that, dominoes, and then also just writing things down, establishing our calendar, things like that. It's very helpful ways to catch yourself and help remember.
Okay.
Also, and with any condition, it's exercise is very, very important. Diet, just eating whole foods, trying to avoid processed foods. I know it's difficult in this time, just do the best you can. As well, same for exercise, just if you can only tolerate, going on a long walk, then that's all I can ask you. That's better than nothing, so we appreciate that. It's also important to educate your family, that, there might be some mild cognitive impairment going on. Would it be okay if we contacted your emergency contact that we have here?
Yeah, that would be great. I know my daughter would appreciate it.
Perfect. All right. And also, we'd also maybe like to refer you, if you like, to a neurologist. They would know more about the exact extent of your cognitive impairment, like why it's happening per se, as well as exploring other treatment options. Would you like to me to refer you or give you those numbers?
Yeah, that would be great. Any help?
So, and it's one thing that kind of goes unsaid or is not said enough. Is just social engagement, social interaction. It's exposing your brain to new stimuluses. It allows you to it allows you to remember more and excite your brain per se.
Mm-hmm.
It's just very good as far as mental health and overall brain health as it is. And so, going to play bingo, going to eat with your family, going to eat with friends, things like that. Those are also very, very beneficial. And there's also websites and things like that, like other resources. Like there's government resources that you can seek, or a common resource that online that people use is like A Place for Mom. That's a common one that people use just as far as tips and tricks for battling any minor type of cognitive impairment, like also dementia, things like that.
Okay.
All right. So would you like us to maybe get you a medication today or anything like that?
Yeah, that would be great. I've been thinking this is
Nope,
my fault.
No. If you don't want to, that's fine. But if you'd like to start, we can start on the lowest dose possible. Just start your baseline. Would you like something like that?
Yeah, that would be great.
Perfect.
Helps to hear there might be a chemical thing. I've just thought it was my.
No,
my
we're
fault,
not
my
going
brain.
crazy. You're not going crazy. And do you live alone?
Yes, I do.
Okay. Like, you drove yourself here and everything?
Yes.
Okay.
Mm-hmm.
All right. Well, Morgan, do you have any questions for me?
no, that was all really helpful. I'll definitely start taking some meds and trying some of those things.
Well, just do what you can, okay? What if you have any questions, or if your condition worsens rapidly, come here or go to the ER, either way. We prefer to see you back in here or the neurologist in 3 months just to monitor any progression or regression of the disease, as well as if we need to increase medication, if we want to change medications, things like that. But any other questions?
No, that's it.
I'm gonna go consult my preceptor. If you need anything before you leave here, we're gonna get you all the stuff, all the information before you leave. If you need anything, don't hesitate to let us know. Okay.
Okay. Sounds good. Thank you.
Well, hope you have a good day.
You too.
So throughout the exam, I've assessed her level of consciousness. Is she reactive to the things I'm saying? Is she looking around the room? Is she acknowledging? If I'm looking at her eyes, is she acknowledging the things I'm saying? Is she blinking? Is she reactive to the sun coming through the window? Things like that. Just make sure everything's oriented, everything's there. So, first question. How would the ethnicity, race, gender identity, and social determinants of health of your patient affect your interpretation of the MMSE? So, first, you guys, that's a common one, or the most important thing is language barrier. People use words in different ways. If someone from a different culture they use words different ways than I might. I might have words in my language that they don't even have in theirs. And the way that they say things can just be different. As far as the slang and the method and the tone of which they say things it can just be really misunderstood. And I just think it's something that it should be acknowledged. Next is you have to acknowledge the race. Race, ethnicity. It's unfortunate, but if I'm a different skin color than them, or if I come from a different place than them, it's not out of the ordinary that they might not trust me. They might be very, very, very distrustful of me. I just think it's important to establish empathy. Show them that you're open and willing and honest and authentic with them. I think it's just very, very, very important. Also, it goes the same way with gender. I'm a man, so there may be a woman there that has a lot of bad experiences with men, and it may be hard to conduct the exam or conduct the encounter or interview as a whole just because she has bad experiences with men, which is extremely fair, and there's nothing wrong with her not trusting me because of past experiences. All I could do is just do my best to cushion or ease the tension just the most I can. There's also gotta address education. Are they understanding what I'm saying? There's people out there that they might not have graduated high school, that they don't know what design means. Just random things like that. It's just important to be clear and thorough whenever you're getting the interview. And there's also socioeconomic status. They may be under a lot of stress because it's like, can I afford this interview? And that might construe some of their answers, put that extra thing in their mind, that's causing them to answer weird. And that goes on with my next point, is just stressors. It's very hard to act normal and conduct under your full potential if you're nervous. Now that's a big thing with people come into the hospitals, is they're stressed out. It's like, God, am I gonna have to get a shot? Am I gonna get bad news that I have cancer? Am I gonna have a provider that's very rude to me, that doesn't actually care about me? It's a very real thought. And another thing is, a lot of people just don't have social support groups to get them here to this exam, as well as conduct the exam without worrying about judgment when they get back. If they don't have that support group, as far whether it's some community organization, or whether that's their personal circle of friends, it's if they aren't totally accepting of someone seeking help, that can run in the back of their mind, as far as how well they want to answer. Number 2, what would a preliminary treatment plan that incorporates evidence-based strategies for managing cognitive impairment look like? So a lot of it was kind of ran through in my interview. It's trying to balance between medicinal and non-medicinal therapies. I think the most important thing is ask the patient what do they want, and you want to ask them like if they want, even if they even want medication. That you don't ever want to force the medications on them, but ideally depending on the severity of their cognitive impairment, you could recommend to them medications, but it's always recommended, not ever forced or the only option. I just think, and then you also want to make sure you're thorough with explaining that there's cognitive exercises they can do, writing things down, having that education as far as steps they can take as well as their family can take, to combat possible cognitive impairment. You want to also emphasize, it's not emphasized enough, is social events and gatherings. Those are very, very important as far as introducing the brain to new stimulus, which excites the brain and just makes it more active. I think it's very, very, very underemphasized. It's also important with any condition is good health, good hygiene. Try to get exercise. Don't tell the patient they have to do this. Just tell them to do the best they can. That it's just recommended, and whatever they're capable of is the best that they can do. So I also want to maybe recommend this to a specialist, or recommend them to a specialist, because it's never a bad idea to have another one's insight on an illness, as well as someone who is definitely more prepared, more insightful upon mental illness or any type of condition. Also, you want to recommend that they follow up with someone within the next 3 months just to monitor progression or regression of the disease. Lastly, just to provide them with other more, I guess, less known resources like websites, government programs, things like that. And number 3, reflect on your communications techniques during the encounter. Were you empathetic and respectful? How so? How could you improve your communication in future patient interactions? Were you empathetic and respectful? I feel like I was empathetic and respectful. I tried to start the interview, asking them, what do they think's going on? I tried to inform them that this isn't their fault and that they're not doing anything wrong and that they're just doing the best they can, and that's the most important thing. I could, with any medicine, I feel like it could definitely be more personal. I think that just has to do with trying to manage other patients. Because when you're being personal with them and taking time, you're also taking time away from other patients. It's a hard balance to maintain, but it's an art in itself for sure. I feel like I was respectful just because maintain eye contact. I tried to use yes ma'am, whenever, and I tried to acknowledge them properly when I could. I try to maintain their boundaries, ask for consent, all things above. And then how could you improve your communication in future patient reactions? Seeking workshops, certifications that improve your social skills / interview skills is never ever a bad idea. I think that can be done just to improve my interviewing skills, or improve my future patient interactions. Another thing I think is very important, I like to do it, and it's an art that just keeps on going, is just trying to ground yourself, be present before you go in there. Just think about putting yourself in the patient's shoes. I don't do it all the time, which is something I'm guilty of and something I want to strive to do, but I just think if I can just find myself being grounded at all times, even during the interview, I think it's just one of the best ways to improve my interviewing skills, improve communication.